Hi everyone, welcome back to my YouTube channel. Today we are going to talk about occipital bone. So let's start the topic with introduction of occipital bone. Occipital bone is a single unpaired cranial bone that is located at the back and base of the skull. It forms the posterior part of cranium and surrounds the foramen magnum, that is a large opening that allows communication between the brain and spinal cord. The occipital bone contributes to the cranial base, protects the brain, and articulates with the vertebral column, making it one of the most vital bones of the skull. Location and structure of occipital bone. It is situated at the posterior and inferior part of skull, as you can see in the lower diagrams. It forms the posterior cranial fossa which houses the cerebellum and part of brainstem. It articulates with the parietal bone, temporal bone, sphenoid bone, and first cervical vertebra. Parts of occipital bone include squamous part, basilar part, and lateral part. First is squamous part. It is large flat portion that forms the back of the head. Externally, it features the external occipital protuberance, that is a bony projection where neck ligaments and muscles attach. Extending laterally from this point are the superior nuchal lines and inferior nuchal lines, which provide further muscle attachments. Second part of occipital bone is basilar part, that is located in front of foramen magnum. It extends forward to articulate with the sphenoid bone. It forms part of clevis, that is a slope that supports the brainstem. Third part of occipital bone is lateral part. They are found on either side of foramen magnum. Each contain the occipital condyle, that is a rounded surface that articulates with the atlas, that is first cervical vertebra, to form the atlanto-occipital joint, and that allows nordic movement of the head. It also contains the hypoglossal canal through which the hypoglossal nerve, that is 12th cranial nerve, passes. Important features of occipital bone include foramen magnum, that is a large central opening that allows passage of spinal cord, vertebral arteries, and spinal part of SSC nerve. Second, it has external occipital protuberance, that is a prominent bump on the back of head that is palpable under the skin. Third is occipital condyles, that is smooth rounded structures that articulates with atlas, allowing flexion and extension of head, that is chest movement. Then it has nuchal lines that are bony ridges that provide attachment for muscles of neck and back. Articulation of occipital bone. Occipital bone articulates with parietal bone at lambdoid suture. It articulates with temporal bone laterally. It articulates with sphenoid bone anteriorly at the base, and it articulates with atlas, that is C1 vertebra, through the occipital condyles. Functions of occipital bone. First function is protection. It forms the posterior wall and base of cranium, enclosing the cerebellum and brainstem. Second function is support. It provides structural stability to the skull and articulates with the vertebral column. Third function is passage of structures. The foramen magnum allow vital structures such as spinal cord and blood vessels to pass. Fourth function is movement. The occipital condyles enable nodding and slight lateral movement of the head. Fifth function is muscle attachment. It serves as an anchor point for neck and back muscles. Conclusion of this lecture video. The occipital bone is vital unpaired cranial bone that form the back and base of skull. With its key structure that are foramen magnum, occipital condyle, external occipital protuberance, and nuchal line, it not only protects the brain and connects the skull to the spine, but also allows head movements and support essential neural and vascular connections. Its importance lies in both protection and function, making it an indispensable component of cranium. And this was all about occipital bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.